Alive and Well STL is a presentation of the St. Louis Regional Health Commission with the first decade review of health status report to build a healthier St. Louis, and Rare Gem Productions. Power up with the positive. Learn more at oneraregem.com. That's ONERAREGEM.com.
Support for Alive and Well STL comes from Beyond Housing, helps entire communities become better places to live. Learn more at beyondhousing.org.
The Regional Health Commission works in partnership with regional health sector advocates and stakeholders to improve healthcare access, reduce health disparities, and improve health outcomes for the uninsured and the underinsured in St. Louis City and County.
Alive and Well STL with Bethany Johnson-Javois, CEO of the St. Louis Integrated Health Network.
We are both humbled and extremely excited to be starting our third season of Alive and Well STL today, during a time when our community is coming together to find a way, or perhaps many ways, to affect positive change, to begin the healing process, which has been a long time coming.
And we think that's just an important piece of justice, that people who are sick get access to the same medicines and the same treatments as everybody else. What we're finding, though, is while that's necessary and important and just, it's not sufficient to build a healthy community. What we're finding more and more is that people can't be physically healthy unless they're mentally well, too.
Over the years, we still see the same things happening. Thank God systems come and systems go. And so what I see over and over are efforts from somewhere to save the people. And the people, to me, are those people who need health care, who need understanding, who need somebody to care.
We hope the voices we can bring to you play a part in the change and in the healing process. We'll be right back.
Rare Gem Productions, proudly presenting, promoting, and producing positive programs. Wellness Mondays are back with Alive and Well STL. And every Monday at 10 a.m., listen up for first-rate frontline information, conversations, and the strategies, tips, and resources to live alive and well. It's great to be alive. Be alive and well, STL. 10 a.m. Mondays. Rare Gem Productions, proudly presenting the positive.
Hello, and thank you for joining us today. I'm Bethany Johnson-Javois, CEO of the St. Louis Integrated Health Network and host of Alive and Well STL, sponsored by the St. Louis Regional Health Commission. Today in the studio, I am happy to be speaking with Robert Fruend Jr., CEO of the St. Louis Regional Health Commission, and Rosetta Keeton, patient advocate for the Regional Health Commission. Today, they'll be sharing with us what we can expect in this third season of Alive and Well STL. Thank you both for joining.
Thank you.
Thank you.
So we started this conversation about what it means to be alive and well a year ago, right here on this show and this space. Today, we are back on the air as part of a larger initiative led by the Regional Health Commission and its many partners, which we're going to talk a little bit more about in a few moments. Rob and Rosetta, as your introduction, please create a vision for us for what it means to you today to be alive and well in STL.
Okay, so I guess I'm starting. And I thought about that, and I thought about what does it mean today to be alive and well? And with the whole encompassed everything that's gone on, and I have to recognize that I think that being alive and well to me today, as we speak, would mean that we all in the city of St. Louis and all of our communities recognize that we are the products of our experiences, and that we recognize that there are inequities and social determinants flourishing in our community, and that we are determined that we will make changes that will result in the whole community, the entire city of St. Louis and its region being well and healthy, both mentally and physically. That's my vision for today.
Rob, what are your thoughts on the definition for you of alive and well?
Sure. For the last decade, the Regional Health Commission has really focused its efforts on making sure everyone gets access to medical care when they're sick, regardless where you might work, regardless how much you make, regardless what you look like, regardless what disease you have, regardless of what your sexual orientation may be, regardless you get health care when you're sick. It wasn't always that way in St. Louis, and we still have work to go to get there here, but we've made a lot of progress in 10 years. We think that's very important to being well, and we think that's just an important piece of justice, that people who are sick get access to the same medicines and the same treatments as everybody else. What we're finding, though, is while that's necessary and important and just, it's not sufficient to build a healthy community. And so we're working now with a lot of other partners to make sure other components are addressed. What we're finding more and more is that people can't be physically healthy unless they're mentally well too. And too many folks in our community are living with the burden of traumatic events that have happened to them, are living under toxic stress. They're living in environments that just aren't healthy or safe. And until we address that, we really truly won't have health in our community. So while the commission isn't giving up on its mission of making sure everyone has adequate medical care when they need it, we're also looking at how we can stay mentally strong and help each other to do that in the weeks and months and years to come.
Rosetta, I want to ask you personally, give a little bit about your background here in St. Louis, the work that you've invested in your time here with us, and tie this alive and well concept, this alive and well feeling to the history of healthcare in St. Louis for you.
Wow. That's going back many, many years. First of all, I'm a native St. Louisan, and probably all of my working world life has been advocating for the uninsured and underinsured in some way or other, either as the immediate job or as just an avocation. I've always been in community services. I've always served the community in some aspect. And what has happened and is still occurring, maybe I didn't know the terms, and we have fancy terms now. You know, we have social determinants, and we've always had them. People who were financially unable to provide for themselves adequately, people who were ill and didn't get equal treatment and fairness in healthcare systems, going back to when people were, I even have a friend who said she delivered her baby in the basement of one of our major hospitals. And so that's in my lifetime. And we see inequities in healthcare and misunderstandings in mental issues, stigmas that are attached to everything. And it hasn't changed that much. Over the years, we still see the same things happening. Thank God systems come and systems go. And I remember praying to God once saying, God, what's going to happen? What's going to happen? And he always said he would save the people. So what I see over and over are efforts from somewhere to save the people. And the people to me are those people who need health care, who need understanding, who need somebody to care, be it physically, mentally, emotionally, financially, whatever. I think in this day and age, we have the Regional Health Commission. Thank God for the Regional Health Commission. And thank God for Gateway Demonstration Project and the Better Health. That's what we currently have.
What's missing?
The missing portion, I think, is the fairness and the equality and the understanding and acceptance of who we are, what our experiences are, and how that affects our well-being.
And the concept of, in God saving the people, there's an element for us to do to save ourselves. So how does Alive and Well tie all of this together for you to give you some hope about the future, given what you've seen in the past?
I think Alive and Well allows us to ask the question now, what happened to you? What happened to me? How did I get to where I am? How did you get to where you are? And I think Alive and Well is going to be able to help everybody to recognize who they are and how they will impact somebody else, and what we will be able to do together to make ourselves and our community whole and well.
So, Rob and Rosetta, what is your expectation in this season 3 and moving forward with the work of the commission? What can we offer to this community to begin that healing process that we know is going to be needed? What are your thoughts?
Well, one of the things that the commission to expand this Alive and Well concept was the success of this show. We were overwhelmed by the community response to what we were doing here on the air. And many of our folks said we need to do more of this and be out in the community more with this kind of work. And we appreciated that and heard that feedback. And then we said, well, how should we sharpen our focus? What should we look at? And folks said, we really need to think about how we can all be well in a holistic manner. And we've done a really good job in St. Louis of separating the body from the mind and treating what's wrong with you, treating what physically ails you, but not really going past that and looking at what's occurring in people's lives that may be causing the physical distress. As I mentioned, we've done a really good job, and I say we're a national model. This is other people saying this across the country, for getting folks into healthcare when they're sick. We're not a national model for keeping people healthy. And what's missing is that link towards what's going on in people's lives, what's going on in their experience. And instead of treating the broken arm and the black eye, treating the underlying cause of why that woman might have gotten that black eye and broken arm, and thinking about what supports we need to help her so that she can be truly alive and well on an ongoing basis. And our community's not very comfortable talking about these things. You know, if you break your foot, people are very willing to talk about the surgery on their foot and who their surgeon might be. But if you're feeling sad or blue, or you're depressed, or you're engaging in a lot of drinking or substance abuse or whatever, we don't talk about that. We don't say, I'm feeling really bad, or I just don't know how to get my drinking under control. I mean, those are not topics that are safe to talk about with our friends, with our family, with our pastors, with even sometimes our medical professionals. And so we're not able to get holistically well. We're not really allow ourselves to be alive and well because we're treating the physical symptoms, but not the spirit and the mind at the same time. And we need the supports in our community to do all of that. And we really underinvest in our community in being mentally well. And we don't even know how to have that conversation with each other. And what we're really hoping with this show is we learn to talk about these things honestly, with integrity. It might be a very difficult conversation to have at times, but if you can't say what's going on with you, and we can't understand this as a community and say, what happened? Not what's wrong with you, but what happened to you to get you in this spot, and how can we help you through it? We're never going to be a healthy community. And that's so much more true in August in 2014 than it's ever been in our community's history.
Rosetta, I want you to think about the patients, the families that you speak to on the phone every day. You work with people in multiple venues and ways to really assist them in getting access to whatever it is that they need. How does the concept we're introducing of asking an open-ended question of what happened, being empathetic, really listening and being present with this patient population that you're talking with, how would that transform those individuals that you speak with? If we really do this right, what would be the impact of this?
I think the word hope keeps coming to my mind. When you listen with your heart instead of your head to what somebody has to say, Of course, you use your head in helping to develop resources or thinking about resources that you can offer. People understand that you care, and people understand that they have a listening ear. I often have people say to me, even though I have to say, I really can't help you with that right now. They say to me, but thank you for listening. Thank you for caring. And I think I'll go and try A, B, or C. And so once you give a person hope, then the world comes alive for them again. There are so many people that don't have hope, who live in hopeless environments, who don't have anything or anybody around them who can offer them that ray of hope. As a community, we should be able to offer that ray of hope. And if we offer that ray of hope, it's going to catch on. And as we help each other, because that's what it takes, one person helping another person, sharing what it is that they have with that other person, sharing what they know, offering their experience, offering who they are and how they got to where they are, so that somebody else knows I too can be okay. That's key in being alive and well, and we must be able to do that with each other.
So what's the one thing that you want to tell listeners that they can start doing today that puts themselves or their family or this neighborhood or our community back on track with being alive and well? I'll ask both of you. What's the one thing they can start with today?
Yourself. You have to be, somebody wrote on a piece of paper that I said, you have to be the leader. Well, you do have to be the leader. You have to make yourself the one key to making your community alive and well. You have to be. I have to understand what happened to me so that I will know how it feels and be able to listen and understand what happens to somebody else when they tell me what happened to them.
What do you think, Rob?
This show and this initiative will give folks a lot of tools and techniques and tips for how to help others. So we hope you join this conversation and listen, because I think we need to be there for each other. If we count on institutions or organizations to step in, we're going to be waiting a while. It's going to need to be reaching out to each other, and we're going to provide you in these conversations ways to do that for each other. But you start by listening, and you start by not judging folks and just listening and meeting them where they're at, loving your neighbor as yourself, and that's a good start. That's what we can do personally. But as Rosetta says, it starts with us on one-on-one individual relationships and just being there for each other. And instead of asking, what's wrong with you? Asking, what happened and how can I help?
Thank you both for joining us today and for all of the hard work and great work that you're doing in this community.
Alive and Well, STL. Thank you for joining us today. For resources available, go to aliveandwellstl.com. If you have more questions about the program, need help, or want to connect, please call the message box at 314-333-8369. The Regional Health Commission with Chief Executive Officer Robert Fruend Jr. committed to providing a detailed review of change over the past decade in 14 leading health indicators for the city and county of St. Louis. The first decade review of health status report, an update to building a healthier St. Louis. Discover the narrative, the data, and celebrate the progress already made to improve healthcare access and reduce health disparities in our region. Learn more at stlrhc.org. Alive and Well STL is another positive production of Rare Gem Productions. Thanks for listening.